Hello and welcome. I am Professor Khalid Khan from University of Granada in Spain. We will talk about the effect of pollution on the outcome of pregnancy with respect to gestational diabetes. To discuss the topic with me, I have Dr. Malak, who is my colleague, but for recording the video today, she's joining me from Belgium. Malak, can you please introduce yourself?
Thank you, Khalid. So my name is Malak. I am from Morocco. I am doctor in clinical medicine and public health from the University of Granada. And I usually work about maternal health, lifestyle, and contaminants.
Okay, thank you, Malak. Can you briefly introduce the topic of today?
Yes, so gestational diabetes, as known, is the most frequent metabolic disease during pregnancy, and it is a public health problem with a multifactorial characteristics. So, not all cases of gestational diabetes can be explained by the lifestyle. So, the idea was to think about what other factors can be related to gestational diabetes, especially thinking about endocrine disruptors, like it is the case for persistent organic pollutants.
Okay, thank you. So, Malak and I, along with other colleagues, have an article published on the topic in the British Journal. And this work was undertaken jointly with colleagues in Madrid as well as in Birmingham.
Mhm.
Malak, can you tell us a little bit more about what is
Yeah.
persistent organic pollutants?
So, persistent organic pollutants, they are a contaminants that are present in uh, in several elements in our life, like pants, fire extinguishers, pins, food packagings, batteries, and several treatments used for textiles also. So the contamination is in our daily life.
So, this risk is present all around us, and it may be associated with a serious problem like gestational diabetes. Malak,
Exactly.
how did we do the scientific work to get the results that we will describe shortly?
So our objective was to estimate the strength of the association between the exposure to persistent organic pollutants and the gestational diabetes using meta-analysis methods. For that, we selected three data sources to recuperate published studies, and we used a protocol that we registered previously. We selected cohort and case control studies. Analyzing the association between persistent organic pollutants and gestational diabetes and using biological samples like blood. Finally, we selected a total of 16 studies for this systematic review and meta analysis, and we assessed the risk of bias of these included studies using QUEPS methods.
Where did these studies come from?
Curiously, the most of studies come from China with a person with 51%, and then United States with 31%. However, no studies come from Africa or from Latin America, even the high level of contaminations in these geographic areas.
What pollutants were we ultimately able to study then?
Finally, in the meta-analysis, we included the PFAS, PCBs, BDA, and pesticides, organochlorin pesticides precisely.
What was the quality of the studies?
So, regarding the risk of bias of included studies, in the most of them, they had a moderate risk of bias, and just 6.25% had low risk of bias. And as you can see, the most of items evaluated with our methods show a good risk of bias. However, some of them still had a poor quality.
Okay, so we are dealing with a mixed quality literature.
Mm.
What were our results? So
So,
what were the results, Malak?
from all the persistent organic pollutants that we can synthesize in a quantitative way, only six of them show a possible association with gestational diabetes. As we can see, there are six of them, and they present a standardized mean difference between gestational diabetes cases and controls.
Okay, so six of the pollutants were found to be associated with higher risk of developing gestational diabetes. From these findings, what can we conclude?
So, the first conclusion that we can have that yes, possibly some persistent organic pollutants may increase the risk of gestational diabetes. However, we should consider the quality of included studies, and also we think that it will be important that scientific do more research, more robust research, and try to analyze persistent organic pollutants in a standardized form to facilitate the synthesis of data between all the available studies in all the geographic areas. However, as we can see the possible effects, we also can recommend to the mothers to avoid all sources as possible as they can, to avoid the sources of contaminations, as the use of pens with anti-adherent treatments, the food packagings, and use more natural food, and also wash food because of the presence of pesticides in there.
Okay, so there is no need to be alarmed, but there are possible actions that can be taken to
Exactly.
minimize the risk. Well,
Mm.
with this, I'd like to thank you, Malak, very much.
Thank
And
you.
I hope this video is helpful to our audience.
Thank you.